All right, so E1 techniques for the knee. There are quite a few of them, but start with the patella first. Patella, you want to find a loose back position of it. So first I'm just going to find where it's most mobile. So starting with just regular extension. Okay, and then place my little makeshift wedge under his knee to get in the loose back position for the knee. A little more rigid. And then we place this under his heel, get into hyperextension, check it there. I think it's about right there. It's where it's most mobile, so I'm going to use this for the glides. First glide is a superior glide of the patella, and that's going to help with extension. So it's very simple. Web space, find the bottom part of the patella. Keep your forearm in line there. And just sail it straight up. And then inferior, same thing, force arm parallel, helps with flexion. Straight down. You can also do a medial glide, which helps with flexion, extension, and internal external rotation of the tibia. So medial, got my thumbs here, fingers are just kind of cradled wherever it feels stable, and just pushing medially. Feel okay? And laterally, the fingers. There's also some patellar tilts. So what you would do in this case, if you want to do an inferior tilt, you're going to contact the superior part of wherever it's going or tilting towards is the name of the tilt. So I'm going to do an inferior tilt, so I'm going to contact the superior part of the patella, and I'm going to have it glide inferiorly. So this is a joint plane motion for all motions of the knee. And then superiorly, exactly the opposite. Okay? And then there's also a lateral tilt and a medial tilt. Very, very simple. Next, I'm going to do some distractions of the tibia, first in loose pack. So this is another joint plane motion that helps with all motions of the knee. So you want to get in about 20 degrees of knee flexion. Oh, you got which? This one? Yeah. Okay. Here's wedge. Right up there. Okay. And then have you scoot forward a little more. Where your ankle's hanging off the table. There you go. Okay, so first thing you want to do is palpate the joint line, because that's what Dr. Carr loves. So, stabilizing hand goes on the distal femur. This one goes above the malleoli. And you're kind of keeping that forearm right in line with the joint line. Then you're going down, you're going to punch up the skin first. Apply your distraction. You okay? So that's one version of the tibial distraction. Other version, they'll be supine, and we're going to do a leverage technique. So leverage technique is only used for treatment. It's not officially used for assessment. So in case they ask you that in the practical, it's a treatment, not an assessment technique. So we're going to bend the patient's knee at about 90 degrees. Try to get it about right there. You're going to kind of use your hip to help guide the movement. So you're going to place your hands right above the malleoli. Try to get your elbow or your tricep area right in your hamstring. And then it's kind of like that, right? Where you're pushing back. Okay, so you
just bend it the knee. You don't have to move the hip.
Okay. So you're going to bunch up the skin above the malleoli, and then you're just bending the knee. You okay? There you go. And then there's also a prone distraction of the tibia, but not going to mess with that. There is one, however, in sitting. So I'm going to have you sit up here on the edge of the table. And it would be a lot easier if you had a high-low table, but
Was that into the camera?
be a lot easier if you had a high-low table, but we don't, so we're just going to make do. So ultimately what you would want, try to make the most of this, so you get a good snug feel right between your legs, or get the patient's leg right between your legs. You rise the table up, and then, yeah, so we'll pretend that you did. You place your hands right behind the proximal part of the tibia, and then you're just gonna kind of distract forward. What's that?
Anterior glide.
Yeah, it's essentially gonna be an anterior glide. I feel okay? And this is something that will help with extension. Right. Okay, so that kind of brings us to the posterior and anterior glides of the tibia. So align your back. This posterior glide of the tibia should be pretty easy. Same thing, we're going to place it in the loose back position of about 20 degrees. Stabilizing the femur, palpate for joint alignment. Shout out to Dr. Carr. Stabilize the femur. And then you can get your manipulating hand right on the proximal part of the tibia. You can kind of lean over, make sure you're in line with the joint concavity. And you're just going to push straight down. Feel okay? And this is a component motion to help with knee flexion. And then with an anterior glide, you can go ahead and go into prone. I'm going to stick that wedge under the quad. Try to get into about 20 degrees of flexion. Stabilizing here, you're going to, that's right, you're going to bring your leg right up here. And same thing, you're going to get in line with the joint line and push straight down. You okay?
Mm-hmm.
This is a component motion to help with extension. Okay, next you have some AP glides of the medial and lateral tibial condyles, both in prone and supine. I'm just going to show you the ones in supine, so go ahead and lie back on your back. So there is a posterior glide of the medial tibial condyle, and that's a component motion that's going to help with knee flexion and tibial internal rotation. Yes. Loose back. Palpate for joint alignment. Find that medial condyle of the tibia. It's right about there. And all you're going to do is kind of get in line with your joint surface. And you just kind of push it right down through the thenar eminence. Back up. You okay?
Mm-hmm.
Now you can also do a posterior glide of the lateral tibial condyle. So if you do that, then make sure that you reach over. Kind of same thing, except that you're just pushing on the opposite side. Palpate for joint alignment. And the lateral condyle of the tibia. And just going to reach over and push You okay?
Mm-hmm.
And this is a component motion to help with extension and external rotation. And then you can do it in prone where you do anterior glides, but I won't mess with that right now. Next, you have a posterior glide of the femur. Posterior glide here. May actually have you take me through this because I don't exactly remember off the top of my head.
Posterior glide of the femur.
Yeah.
So same thing. Put the wedge in my calf.
Okay, so you put the wedge under the calf and then
Stabilize there.
oh, so you just duh, of course. So this is going to help with extension. Yes. So palpate for joint alignment. Extra brownie points from Dr. Carr. Stabilize the tibia. Place the manipulating hand on the distal femur. And push straight down the femur. You okay?
Mm-hmm.
Anterior tilt of the tibia. So you're going to put the knee in a closed pack position, right about there. Ask the patient if you can sit on their foot. Cool. And then you can kind of cradle your fingers behind the tibia, place your thumbs right under the joint line. So palpate the joint line, right about there. And then you kind of use your elbows to help you out with this. So what you're going to do is you're going to kind of spread your elbows out as you do it, and as you do that, you're kind of doing upward tilt in a sense. So start right here. Yeah, and then is it like that?
And it's not so much your thumbs, it's your
Okay. Okay, so
start out.
yeah, gotcha. So out and in that. Okay. So you start with your elbows out, and then you upwardly tilt, bring your elbows in. So this is what Dr. Carr really likes. So if you want the most amount of points practical, I guess go with that. And that's a motion or a it's a component motion, right? I think it's a component motion to help with flexion beyond 100 degrees. Guess we'll look that up in a second. And then lastly, we have some fibular head glides. Yeah, we'll look that up in a second. So fibular head glides, we have a posterior medial and anterior lateral glide of the fibular head. So we're gonna find that real quick.